Oni is basically trying to cater to the 98% of the pregnancy which is today clinically unmonitored. Where we're really looking at is to operationalize this category exactly what IVF did to the fertility industry. Every mother goes through pregnancy. It's a 40-week continuous physiological and anatomical change that the mother goes through. But unfortunately, monitor the mother only between 8 to 10 times during the length of the pregnancy. When you look at the challenges that the mother has, absolutely no way that she can actually get clinical support. Today, when we look at peer-to-peer networks, your communities, there are almost 25 lakh mothers sitting, spending a minimum of 10 minutes talking about symptoms and complaints, almost 70% of the conversation. That's the kind of volume of pain that exists today at an ecosystem level. What really goes wrong is the health of the mother. I think we all know where the health of the mother is. I think there's enough and more data. The biggest complication, obviously, is the fact that the health outcomes itself are very poor. When you look at the 9 months journey, almost 2 out of 3 newborns today have growth shunting, so not enough weight or not enough height at birth. That is where we believe early detection can actually help, and there are enough and more clinical studies to focus on really where early detection just by single clinical parameter, which is blood pressure, you'll be able to reduce preterm births by 10 or 20%. The problem is not only just a single-sided problem, it's an ecosystem problem. We all know that today almost 1 out of 2 mothers are high-risk pregnancies. But today care is exactly the same for every mother, where the big challenge obviously occurs is pregnancy is longitudinal, really looking at 150 plus data points that need to be captured. EMRs today that exist are purely data storage systems and not intelligence systems. And between 2 consultations, the OB-GYN has zero visibility of what really has happened in those 4 weeks. Even risk frameworks that exist, they are the oldest and the only one, which is the Hobbles model, was published in 1973. Where we come from, it's not the skill, it's the ecosystem support that OB-GYNs lack today, which really help. Only really does. It's a 2-part ecosystem. There's a clinical ecosystem for the OB-GYN and a connected to a mobile app for the pregnant mother. The OB-GYN ecosystem voice captures, it's an AI-enabled voice capture system that we build for them. Right at the first consultation, it really helps the OB-GYN determine the risk, basis clinical pathways, everything is programmed. So we have an LLM which really supports personalization of care for the mother, and that is where clinical pathways get decided. So today, the biggest challenge for an OB-GYN in an OPD, every mother is in a different week. Personalization is practically impossible. That is exactly what they're really trying to help using the clinical pathways. But also today, we're also helping the OB-GYN today get the clinical data, which is today a complete black hole. From a mother's ecosystem, again, a voice-based ecosystem not only helps her track clinical parameters, basis risk. So it's a high-risk pregnancy. It would ask her to check it literally on a daily basis. A medium risk would probably go different frequencies. But the whole idea is to provide the mother with weekly tasks, which can actually help her not only monitor, keep her continuous, but also determine clinical pathways which can help her assess risk and go and meet the OB-GYN when it is required. To just kind of give you a simple example, if you're hitting 140 plus on blood pressure, it will ask her again to check, monitor after 4 hours. If again she's hitting, then it will give her a medium risk assessment and ask the OB-GYN to meet in the next 24 hours. That's the kind of clinical pathways that have been built in the ecosystem that really focuses more on helping the mother really detect at the right time. We've also added the layer of epigenetics, so really basis how the fetus is growing. The mother gets the recommendations on nutrition, mental health, physical health, as well as sleep and water intake. The whole idea is to create a single point of contact for the mother, which is again powered totally by the OB-GYN itself. How we're really looking at acquiring our customers, so our larger focus is obviously the B2B2C push, where we're not only looking at today, we've signed 2 EMRs, which is Shivam as well as Akhil. Hopefully in the next 3 months, we just started integration with Akhil only yesterday. Hopefully in the next 3 months, we'll have a pipeline almost 1,100 odd hospitals that we can reach out to through these partners. We're also looking at direct sales through OB-GYNs. So cities like Mumbai, etc., where independent OB-GYNs have ruled the roost, we've already signed with them. We've also signed with Ujala Cygnus to deploy the solution with them. From a consumer perspective, the push perspective, we're also building a voice-based platform, a freemium platform which is a downloadable app for the mother, uses to understand. So the whole idea is to really work and look back at mothers who today are sitting on community platforms, huge market, but that then also becomes a feeder to not only help the mother, but also create a pipeline for us. what we really want to really build is the next billion-dollar category. Where we come from is today, hospitals think horizontal. They're not looking at specialization, and pregnancy is very, very unique when it comes to servicing and providing the care. We believe that's where the bigger opportunity lies, is to kind of build that ecosystem, build it differently within, let's assume a hospital. In a hospital, it's a shop-in-shop kind of format, and then eventually replicate what IVF did to the category, create opportunities to take this to a very much larger and differentiated category. Today, IVF would do anywhere from 3 to 4 lakh cycles. The opportunity here is, even if I look at 50%, it's a couple of thousand mothers that we can reach out to. From a GTM standpoint, first 6 months largely really looking at validating the clinical ecosystem, going live with a couple of doctors and hospitals. Over the next 6 months, we would ideally want to experiment with one clinic of our own, build the hopefully the shop and shop model, and then roll out into probably a full scale maternity franchise over the next 2 years. The payment ecosystem, largely it is a free ecosystem for the hospital. The mother pays a subscription fee. So anywhere between 500 to 1000 rupees is what we're looking at charging the mother. The big question is what it is for the hospital. The big challenge that hospitals today face is a number as high as 60% of OPD to IPD conversion. Even one single patient that we add to the kitty is almost 2 lakhs of revenue for the hospital. So it's a great opportunity for what we really would earn almost negligibly vis-a-vis what they actually land up benefiting from. From a ecosystem, where we really believe where we actually do is literally move towards not only focus on supporting the journey itself, but we actually look at 2 more layers of revenues that we can actually push on. Diagnostics is very, very large because we have exactly preloaded tests, etc. the mother can do. That's where we be diagnosis is a huge opportunity. And the second would be for precision medicine. We know exactly which week the mother is in. We also have her data in terms of her health. That's where we be the huge it's about precision medicine, which hopefully we build over the next 2 to 3 years. So we have a whole lifestyle ecosystem that we're really building, say how we can take this to the next level. From a competition standpoint, no direct competition, but there are enough peripheral, ecosystem that we build. The US has Nadia and Malama, both recently raised upwards of 15 million, but they're basically, what they're really solving for is exactly the problem through midwives. Their aggregator of information was very high.
Yeah, just wanted to understand 2 things. At what TRL you are at right now?
So we are 7, we've tested it clinically. We've got live with 2 Afghanis in Mumbai. We should be going live with a couple of hospitals hopefully in the next 3 to 6 months.
So